Stratford, student number 17070663. In this video, I am going to identify global societal and political influences in relation to health and well-being. I will be using the Dahlgren and Whitehead model 1991, where I will be starting at the core of the model with the individual I met in clinical practice. For the sake of this video, I am going to be renaming my chosen individual to Miss Jones. This is in order to obey the NMC code 2015 in respecting the individual's privacy and confidentiality. Miss Jones is a 72-year-old female who has been in and out of employment her whole life due to episodes of alcohol dependency. Miss Jones has initially been admitted with a stroke to our ward, but despite suffering a stroke, Mrs. Jones remains very independent and is therefore able to manage her own personal care with little assistance. Miss Jones, however, suffers with her coordination at times and sleeps a lot due to lack of nutrients. Miss Jones is a single person with no children and has no remaining family members. A lifestyle factor and global influence that impacts Mrs. Jones' health is alcoholism. Alcoholism is recognised as a global health issue by the World Health Organization 2004. According to Beaglehead and Benita 2010, global health is recognised as a specific health issue that causes significant health problems to the world population. For the health issue to be considered a global health problem, data is collected worldwide and must reach a national border in 2 or more countries. In this case, alcoholism has been ranked top 5 of risk factors that increase individuals to develop health issues according to the World Health Organization 2004. They also showed that 16% of the world population are alcohol dependent and an estimated 3.3 million people die as a result of alcohol consumption. In regards to societal influences, this involves Mrs. Jones' social network with friends and family, her housing conditions and whether she is employed or not. Mrs. Jones has no remaining family, therefore she has no support socially other than her friends. However, Mrs. Jones mentioned she does not feel close to these associates. Therefore, we must consider if these associates are individuals Miss Jones just casually drinks with, or if Miss Jones drinks on her own away from any social setting other than her own home. Dahlgren et al. 2009 suggests that retirement is a huge contribution that leaves many pensioners isolated. More so, includes a significant decrease in social activities in comparison to earlier life. Therefore, retirement is another societal influence that has an impact on Mrs. Jones' health and well-being. The lack of social activity has been discovered by the Mental Health Foundation 2006 to be a key trigger that leads to alcoholism, along with loneliness and isolation. Employment prior to Mrs. Jones' retirement remains a key factor to her now, as she was in between jobs. Therefore, she may have found it more difficult to develop friendships and now has no long-standing friends. According to Warmick 1995, retirement is an ageing process which requires adjustment during this change of routine in life with unlimited flexibility. Therefore, Miss Jones would have needed to develop a coping skill in order to adapt to her life as a pensioner, no longer capable of working. Therefore, Miss Jones' coping skill could have led to her consuming more alcohol than she may have done previously while she was in between jobs. Lastly, in society, alcohol is wholly accepted. According to Alcohol Studies 2013, in recent years it is becoming a social norm to visually see individuals intoxicated in the street, whether that be on the weekends, outside nightclubs, homeless individuals in the streets, more so individuals such as Mrs. Jones, just out with associates to drink on the street because it is more cheaper to buy drinks from the shops than it is inside the pubs and clubs. The last but main influence I am going to discuss is the political influence on alcoholism, as I believe this has a big impact on Mrs. Jones. A positive political influence is a fact we are fortunate to have the National Health Service Act 1946 in place, which enables every individual in the UK to access free healthcare regardless of income. Therefore, Miss Jones, being on low income, can always access this service. More so, according to Age UK 2018, individuals over 60, such as Miss Jones, is entitled to free medication prescribed to them. Another positive political influence is a Housing and Council Tax Benefit 2012. Due to Miss Jones claiming the state pension, which is covered by the Pension Act 2014, she is entitled to free full housing benefit. These products can be found on legislation.gov.uk. The negative political influence in relation to alcoholism that affects Miss Jones is the availability to alcohol products. In England, shops do not have a time restriction in when an individual can buy alcohol, unlike Scotland. They made a recent amendment to the Alcohol Act by reducing the hours of availability to buy alcohol in the hours of 10 p.m. and 10 a.m. According to Ecos Direct 2010, this strategy has proved to be successful, with the decline of alcohol consumption and reduction of alcohol-related hospital admissions by 9% since the amendment occurred in 2009. Furthermore, England's government strategy has put a minimum cap price on alcohol products, along with the multi-buy discounting coming to an end. However, this has not prevented Miss Jones in being able to buy alcohol, as she is simply spending more money out of her income to cater to her alcoholism, which therefore reduces the remaining income in buying nutritional foods. The Alcohol Concern 2018 stated that even though price of alcohol has increased by 36% since 2005, it is still very much affordable now than it was back in the 1980s. More so, Miss Jones can keep on buying alcohol as her income is enough to afford these products. The political influence has had a huge impact on Miss Jones, as the prices rising means that Miss Jones will still continue to buy these products but has little amount left to provide herself with nutritional foods. This may be the reason for Mrs. Jones' lack of energy and the reason she sleeps a lot, more than she used to. With Miss Jones not eating an appropriate amount of food, this has also led to her isolation in some sense, as where she sleeps more, she does not associate much with the outside world and spends a lot of time at home on her own. This may also develop into depression if Miss Jones does not already suffer with this condition. The nursing process is a specific 5-step method that is used by healthcare professionals to enable that the correct and sufficient amount of quality care is received by the patient. Firstly, upon Miss Jones' admission, a care plan was created. Therefore, Miss Jones was asked a series of questions to help build a picture of what her life is like outside of hospital. This stage also includes a physical examination, which was very noticeable from Miss Jones' appearance that she looked very underweight. The next stage is the implement phase, where a healthcare professional will decide a plan of action. This phase includes the monitoring of Mrs. Jones to see if there is an improvement or decline of Miss Jones' condition during her stay. Miss Jones was on a food and fluid chart to monitor her intake of drinks and fluid, and also a must was carried out to decide if there would be any intervention, such as a referral to a dietitian or further treatment needed. Observations are carried out 4-hourly for Mrs. Jones to begin with. In this phase, we can also notice that Miss Jones of our care plan, let her know of our care plan action and how she could be involved by instructing her of how she can improve her own health. A referral was made to physiotherapy in this phase to help with Mrs. Jones' coordination. The final phase is the evaluation process, where once all nursing interventions have occurred, and to see if the action plan goals have been achieved. In this instance, Mrs. Jones was discharged after improvement of her condition. However, relevant agencies were referred on to help Mrs. Jones manage at home, such as social services for an assessment of a care package in relation to meal times, physiotherapy to continue for coordination, and agencies to help with Mrs. Jones' alcoholism. In conclusion, I have learnt from Mrs. Jones that individuals come into a ward with conditions such as Mrs. Jones' stroke. However, there are many more implications that may be contributing to an individual's health and well-being. With the experience of Miss Jones, I remember her very clearly due to how I first felt around her. I found it difficult to care for Miss Jones at first due to the way she communicated with me, but I learnt to take my time in getting to know Mrs. Jones, and I did sympathise with her when she felt comfortable enough to open up to me about her past. The future practice it has developed my therapeutic relationships and how I can build upon this, even with patients who at first are reluctant. I have also gained confidence in being able to approach patients with an open mind, regardless of their behaviour, to begin with at the start of their admission.